minutes until your official start time. Do you all want to go ahead and start now? With your screening report.
Okay, I'd like to have an audio test.
Okay, Dr. Tubman, why don't you do an audio test?
All right, testing 1, 2, 3, testing 1, 2, 3. Testing 1, 2, 3, without the mask.
No audio.
No audio. Perfect.
You on mic level? Yes, sir.
Hello, 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 testing. Testing 1, 2, 3, 4, 5. How are you guys doing? Any audio? Or we got audio or no?
Okay, we're on line level.
Dr. Tubman, we do another round.
Testing 1, 2, 3, 4, 5, 6. 1, 2, 3, 4. Testing, testing.
It's better if you sing.
Oh, say, can you sing? Better if I don't sing. Testing, testing, testing. How's the audio now, Billy? Testing, testing, testing. 1, 2, 3. Just trying to, just a shout out to you.
If you want, you can just use my iPhone.
Still nothing?
Is this fine?
Right, yeah, it's fantastic. Testing 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Testing, 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 testing.
Dr. Plattman, what's the story of the lecture hall? What is it?
So these are famous folks who've had an important role to play in our institution. Over there is Corby Robertson and Barbara. The Robertson family comes from the Collins. What is he, grandson of the Collins? And so the building was named. So many of the donor community. We actually were unique in that it was 10 donor families that basically attracted us. We didn't grow out of a giant university or a health system like Mayo or Cleveland Clinic. We weren't part of like a Duke or Vanderbilt or Indiana. So we were just this school that got moved because 10 families wanted really to build the medical center. It's an interesting history. Anything at all, Billy, or nothing?
We got audio.
We got audio.
No, all my camera got. No.
No audio on the camp. Well, apparently there's going to be only exclusive video on one channel.
Have everybody on mic level?
Testing
I
one.
have audio.
Testing 1, 2, 3, 4. Testing 1, 2, 3, 4.
No mic.
Sure.
Thank you.
Do whatever you got to do.
I apologize.
No problem. I'd feel better actually if there was like 15 of them up here, so I could feel it semi-important.
Thank you for your patience.
No problem.
And then down to it all.
Yeah, old school. Get a microphone up there. Yeah. You guys came prepared at least.
Best we can.
Well, let's try this now. All right, testing, 1, 2, 3, testing.
Beautiful.
Testing, 1, 2, it's beautiful now. We've gone from I don't hear a thing to beautiful. That's a step, yeah, that's perfect. Testing, 1, 2, 3, 4, everybody here? You got audio? You got audio? You got audio? Audio? Yeah, audio. So can we start? Well, thank you for the technical challenges that allowed us all to get together here. Really appreciate everybody being here. I want to thank the media for being here. I'm actually really proud of our local media because they have done a great job in covering the pandemic. In particular, they've been really good at trying to keep data in front of their community to try and help drive behaviors. And so I think our local media really deserve a lot of credit. But I'm very pleased to welcome Deputy Secretary of the Department of Health and Human Services, Eric Hargan, and Surgeon General, Dr. Jerome Adams, who requested that we meet today to provide them a briefing on what's going on in our community and at Baylor College of Medicine. And we've met for the past hour or so, and we talked about a lot of our efforts in vaccine research and new therapies and diagnostics. We've talked about all the things we're doing to try and understand where the virus came from and what its potential impact is on health in the future. And they, in turn, challenged us to focus a lot on making sure that all communities are included in research and making sure that we have a plan that is both ethical and reasonable to provide vaccines to people. So that was really helpful to us to know the priorities that they have and the expectation that we will work together to try and meet those priorities in the best interests of the populations we serve, which is our local community. And not just Houston, but the nation. But we're really, really excited that you guys are here. We're very, very grateful. And I'm going to turn it over to you. It's your press conference. So, Secretary Hargan, if you'd like to make some opening comments. Thank you very much.
Thank you. Thank you, Doctor. And good morning, everyone. And thank you to everyone at Baylor for welcoming us here today. Pleased to be here because Baylor is playing a key role in one of the most important parts of our fight against COVID-19, our Operation Warp Speed efforts to develop safe and effective vaccines to beat the virus. I got a chance to learn about the recruitment efforts here at Baylor for trials of the vaccine that's being developed by Moderna and the National Institutes of Health. In order to support approval of a safe and effective vaccine for all Americans, we need to have a large and diverse set of people to volunteer, and Baylor is playing a crucial role in that. Work on the Moderna vaccine began amazingly the same evening that the viral sequence was shared out of China on January 10th, and the candidate vaccine entered human trials on March 16th, a record time to human testing. Thanks to Operation Warp Speed, we now have not just the Moderna vaccine, but 3 other vaccines as well in phase 3 trials. I want to emphasize that we're at this point, and we believe that there is a real likelihood of delivering substantial quantities of a safe and effective vaccine by the end of this year and the beginning of 2021, not because we are cutting out any essential part of the process, but because we're investing in accelerating each of these steps, including by running much larger phase 3 trials than normal, so we can rapidly deliver the same quality of safety and efficacy with these vaccines as we do with any vaccine. These efforts are just one piece of the work the Trump administration is doing to equip Texas and the rest of the country with what we need to beat COVID-19. From surge testing currently being provided in Houston to nearly 13 million N95 respirators shipped to the state through coordination with HHS, FEMA, and the private sectors. But we have plenty of work yet to do. This means that we need to redouble our commitment to the simple, smart public health measures that we can keep ourselves and our communities safe. The 3 W's, as the Surgeon General has pointed out, to wash your hands, watch your distance, and wear a mask. With that kind of responsible behavior and the hard work of American innovators, just like here in Houston, we will beat this virus and we will save American lives. So again, thank you all, just briefly, for having me here today.
Well, good morning, everyone. Thank you, Dr. Klopman, for hosting us. And before we were here, we started the morning off at 7 a.m. at the School of Public Health, discussing both what we can do to prevent disease and what we can do to better treat disease. And I don't want to repeat anything that the Deputy Secretary said, so I'll just help you understand something that we talked about a lot in the last hour, and that is the evolution of this pandemic. When you go back to February of this year, and it seems like forever ago, we had a mortality rate of 30% in a lot of this country if you were diagnosed with coronavirus. There was a lot we did not know. Our nursing homes were hit particularly hard. 40% of the deaths were occurring in 0.4% of the population. And so we reacted appropriately. We reacted by shutting things down. We reacted by flattening the curve so that we could learn more, so that we could get in a better place to be able to respond. And while there is still much reason for us to have concern, I think it's important that we acknowledge how differently we are prepared to deal with this virus now. We have remdesivir and many studies going on here at Baylor on remdesivir and improving the efficacy of that in combination with other drugs. We have convalescent plasma. We have better and quicker test and turnaround times. We have better strategies to reach out to communities that are at risk. And what does that mean? It means we've passed over 100 million tests. The problem now isn't availability of tests, quite frankly. The problem in most places is that we can't get enough people to come in and get testing. And so one of the things that Baylor is doing in concert with the local community is actually sending testing out to the communities, to the people, instead of waiting for them to come in. Our mortality rate has gone from 30% down to less than about 5%, to the place where we're actually having conversations about the risk-benefit ratio of continuing to keep particularly medical services closed relative to the dangers of people now being diagnosed with COVID. And so I want people to understand that there are many reasons to be optimistic. You heard 4 vaccines now in phase 3 trials. Incredibly important to know that we are almost at the finish line in terms of having a vaccine available. We will continue to work with the community. And Baylor, we had a conversation about this. Baylor's doing a lot in this space to make sure when we have a vaccine that is safe and effective, that people trust it. And they will trust it because of diverse representation in trials. They will trust it because of the outreach to historically black colleges and universities, to the Hispanic and Latinx communities out there. They will trust it because it's followed the same process that we follow to develop vaccines from a safety standpoint that we've always followed. There are no safety corners being cut here. It's really about buying down the risk by doing multiple steps at the same time that normally would have taken months and in most cases years to accomplish in a stepwise fashion. And so I want people to be appropriately vigilant, appropriately concerned about us entering flu season, about us entering a season when people are going to be coming indoors, because we know that leads to spread of the virus. The virus likes when we're close together. We don't want to overwhelm our health system capacity. But I want them to be optimistic because we now know that when we don't put people on ventilators early, as opposed to putting them on ventilators early, they have a higher chance of living and getting out of the hospital sooner if they get the virus. I want them to be encouraged because we know that if we follow the 3 W's, wash your hands, wear a mask, and watch your distance, that we can drive down positivity rates to less than 1% even before we get a vaccine, as New York City has done. And I want them to be optimistic because we already have a vaccine that can save thousands of lives, the flu vaccine. So one of the most important things that all of you can do this year is go out, get your flu vaccine, make sure everyone else around you gets their flu vaccine. Leaders, do everything possible to make sure your employees, your community can get their flu vaccine, because it will not only prevent our healthcare system from being overwhelmed, it will also prevent those false positives, if you will. If you actually go out and you have a mild flu this year, guess what? You're going to have a fever. We're scanning people to come into this building to see whether or not they have a fever. You don't want your school, your workplace, your hospital to have to shut down because you ended up with a mild case of the flu that could have been prevented with a vaccine. And I think the flu vaccine is a great opportunity to talk to your health provider about any concerns you might have about vaccinations. Surgeon General of the United States, I want you to hear me say vaccines are safe, they're effective, they're the greatest public health achievement of the last 50 years in this country. And I will be among the first in line when they tell me that a COVID vaccine is available for me, because I trust that the process is being followed, even if people out there don't trust the politics that are being brought up and embedded from all sides into all of this. Trust the process and know that I and my family, as soon as they tell us we can get a vaccine, will be in line to get a COVID vaccine, and we've already gotten our flu vaccinations. So wear a mask, wash your hands, watch your distance, get your flu vaccine, and we can drive this virus into the ground and protect our healthcare capacity and actually be in a really good place so that when we finally get that COVID vaccine over the finish line, we can put this thing to bed and get back to a real sense of a new normal and hopefully a better normal.
Well, great, thank you so much. Good message. Any questions for our gentleman here? Don't all speak up at once. Oh, go ahead.
ABC Child 13, sir. They wanted to ask, the CDC has said while a vaccine could be ready, distributing it could take some time. Why could it take a while to distribute? And what's a realistic time when people can expect the vaccine to be distributed?
Good question. Why don't you guys take that?
So I want people to understand that getting a vaccine over the finish line from a research point of view is just step one. This, quite honestly, is going to be logistically the hardest vaccine distribution that we've ever experienced in history. We got some vaccines that are 2 doses. We got some vaccines that are 1 dose. We have some vaccines that have to be kept refrigerated at an incredibly cold temperature. And it is why, from an HHS standpoint, Operation Warp Speed has spent so much time, so much energy, so much effort up front, making sure we're thinking about how we ramp up production, what distribution looks like. And the Department of Health and Human Services actually last week put out their initial distribution plan that was developed in concert with the National Academies of Science, Engineering, and Medicine. And that was intentionally done so that we had independent people helping think through what are the challenges that are going to be present in terms of distributing a vaccine, working with logistics people from the military who do this all day, every day, and other folks out there that are completely apolitical to figure out how we fairly and effectively get this to the people who are most going to benefit. And Admiral Jerome, the Assistant Secretary for Health, said this a few weeks ago on Good Morning America. He says we could possibly get 90% of the benefit of the vaccine by vaccinating the right 10% of the people. And so that's what we're thinking about now, is how do we make sure our healthcare workers, our frontline workers, vulnerable populations get this vaccine so that we can make sure we're protecting the people who are most at risk for spreading the virus or getting the virus. What I would say to people who want to know when they can get the vaccine, we honestly can't answer that question because the first step is making sure we have a vaccine, but we still do believe we will have a vaccine that is safe and effective by the end of this year or beginning of next year, because again, 4 different candidates in phase 3 trials. I would encourage people to go to the Health and Human Services website and look up our distribution plan and give us feedback, because this has been developed in concert with state and local entities, and it's why we told people, be ready by November 1st. Not because we 100% think we're going to have a vaccine by then, but because we want people to be thinking now about what their distribution plan is going to look like so that we actually can effectively help stop the spread of this virus.
No. And as sort of an extra detail to that is that when we get a safe and effective vaccine, and FDA approves that, again, I'll join the Surgeon General, that as soon as it's available to me, I will take that vaccine. I trust our FDA people implicitly in this. But one thing to remember is that while we are building out manufacturing capacity and distribution capacity at the same time, we're doing that instead of doing it one step at a time. We're doing all of those. We're making sure we have the manufacturing capacity ready at the same time. It does take time to produce vaccines, like it does anything. And so that is going to be the next step when we get a safe and effective vaccine, is manufacturing it and then also distributing it in the rank order that we've been talking about publicly. So I think that gets to it, and then we will have hopefully a number of vaccines, and hopefully we will have them produced. It could be producing at the same time, but they will have to do that in order once we get approval for a safe and effective vaccine.
Any other questions? Yep.
What's the next most promising treatment horizon under operation?
Well, you stand up here with me because some of the next most promising treatments are being developed right here at Baylor University. We think that the next most promising treatment is going to be in the area of monoclonal antibodies. We think those have the potential to be a game changer in terms of treatment of this disease. But again, Surgeon General, public health, I want you all to remember, we don't treat our way out of this problem. We prevent our way out of this problem. And then we want to make sure we continue to have treatments for people who fall through the prevention cracks. Wear your mask, wash your hands, watch your distance. New York City is less than 1%. When you look at Arizona, one of the worst in the country this summer, now one of the best in the country, did it without a therapeutic, did it without a vaccine. And I harp on that because I want people not to just wait and hope that Baylor comes up with a great new therapeutic that allows them to just go out and do whatever they want and then know that you're going to be saved on the back end. I want people to be able to have access to top-notch cardiovascular care, but I want you to prevent that heart attack in the first place instead of just saying, I'm going to wait until I have it, and then Baylor's going to bail me out with a great cabbage. And so the same thing applies here. We will continue to have great new therapeutics. And again, Dr. Klotman, would love for you to comment on those.
Sure.
But the best thing we can do is really focus on these preventive measures. And one of the things that we actually did talk about is that we need to make sure everyone has the education, and we're working with the Department of Education. They're working with local schools, and we learned about great programs where they're going into middle schools and even elementary schools and helping people understand how to stay safe. But we also have to address what we call the social determinants of health and make sure everyone has the opportunity to make good decisions. Only 1 in 5 Hispanics, 1 in 6 African Americans have the opportunity to telework, for instance. Many folks are in frontline jobs. Many of them live in congregate settings, sharing a few bedrooms and maybe a single bathroom. That is not conducive to stopping the spread of a virus that is highly contagious. So all these things go into preventing the disease. We know how to do it. We just have to have the will to do it and to put the funding and resources behind it. And HHS has really looked at that holistically. But I'll turn it over to you, Dr. Clark.
Sure. So I agree with you. Monoclonal antibodies are really an exciting potential for prevention. The anti-IL-6 data is pretty interesting as well. But I would echo something. Remember, Spanish flu disappeared with no vaccine, and it was through public health measures. And one of our biggest problems, I keep steaming up my glasses. That's one of my big problems. One of our biggest problems is education, getting the message to the right communities. We know that the Latinx community has been really hit hard in service professions. We've got to figure out a way to help them learn to protect themselves using masks and social distancing. And we think educating K through 12 kids to understand the importance of public health will hopefully help educate families. But I'd say the biggest opportunity we have is to effectively use public health measures. If we can drive it under 1% in the community, then that's going to be the biggest thing we can do. The vaccine will be great when it comes, but I think the most important thing is we have huge amount of control with current public health measures. One more question? Yeah, go ahead.
Surgeon, with your time here, I guess localizing COVID usage, what have you seen maybe the city move on to significantly more level where they were so high and now at what percent?
Well, it's interesting when you talk about New York because we spent a lot of time discussing how hard COVID hit New York City in particular, but New York State, and how we were all collectively concerned that Houston would be hit just as hard as New York City was, based on the demographics, based on the initial case numbers. And one of the things that I learned today was that Texas Medical Center, in concert with Harris and Houston health departments and the School of Public Health, all coming together, really helped prevent that initial surge that we saw in Houston from turning into the hospitalizations and the deaths that we saw in New York City. So I want to say, first of all, to the people of Houston, thank you for your efforts, because truly it could have been a lot worse here, and it wasn't because of the cooperation of individuals. But one of the frustrations I think people have here is that they don't see that there's an end in sight. And they also think that these measures are like a light switch. You're either open or you're closed. That's not the case. If you want schools to stay open, if you want college football and high school football, if you want in-person graduations next year, if you want spring to be able to go on spring break, this is one of the most effective ways to make sure we can make that happen. Wearing your mask, washing your hands, watching your distance. And I want people to know this won't be forever. Again, we are getting near the finish line in terms of a vaccine, and then we'll start establishing herd immunity across the country, and then we will return to our new normal. But this is a small price to pay for the benefits of being able to stay open. I also think people have a misconception. They think back to March and April and they think shutdowns. We had this conversation also. I don't think we will ever shut down the country again for COVID the way that we did earlier this year. That's not what we're advocating for from a public health standpoint. What we're saying is we know how to control the spread of the virus and stay open, but it only will happen if people cooperate. So we need to do a better job engaging with particularly vulnerable communities, the Latinx and Hispanic communities, the African American communities, our tribal communities, but everyone out there, to help them understand that, look, if you want to stay open, if you want more places open, if you want schools open, we've got the tools to do it. We just need to have the fourth W in addition to my 3 Ws of wearing your hands, washing your hands, wearing your mask, and watching your distance. We need to have the will to actually do it. And that's where I think Houston needs to continue to do the right thing. I don't want to say that you need to that you're doing a bad job, but you need to continue to do the right thing and get us over the finish line of that vaccine.
So I think we're coming to the end. Just for you all's sake, Tony Piedra is in the audience here, who runs our vaccine treatment unit. And for the Spanish-speaking folks, he's fluent in Spanish. And so any questions you have, you might want to ask Tony. Tony? There it's him. Okay. Well, once again, thank you all so much for taking the time. We really appreciate your visiting us.
Tony for a second?
Oh,
Come up here with me, Tony.
Tony, come on. Okay, go ahead. Tony's been running our vaccine treatment unit forever.
So, Tony, my Spanish is really bad, but I'm going to ask you to translate for me and to help me out here. So, yo soy Dr. Adams, or yo soy Surgeon General. Is that correct? Okay. So now you're going to translate for me, because that's the extent of my Spanish. It is incredibly important this year that you get your flu shot.
Es muy importante.
Okay. So it is incredibly important this year that you get your flu shot.
Es muy importante que este año todo el mundo toma su vacuna contra la gripa, contra la influenza.
As the Surgeon General of the United States, I want you to know that the flu vaccination is one of the most effective ways to help prevent unnecessary disease, unnecessary hospitalizations, and death.
Como el Surgeon General de los Estados Unidos, es muy importante entender que la vacuna contra la gripa es la mejor manera para prevenir hospitalizaciones y mortalidades asociadas con la influenza.
Literally, tens of thousands of people die every year from the flu, and they are disproportionately Black and brown people. This does not have to be our reality.
Todos los años, miles detrás de miles de personas se mueren por la gripa. La mayoría de ellos son negros o oscuros o hispanos, y eso no tiene que ser la realidad. Nosotros necesitamos utilizar la vacuna para prevenir la gripa.
The flu vaccine is safe, it's effective, and I got my flu vaccination last week. All 3 of my kids and my wife got their flu vaccinations last week.
La vacuna es segura y efectiva y puede prevenir la influenza. Y como dijo el General Surgeon General, que ellos, su familia, recibió la vacuna contra la influenza para mostrar que es segura y efectiva.
So in closing, one of the easiest, safest, most effective ways to protect yourself, your family, and your community this year is to get your flu shot. Go to vaccines.gov to find out where in your community you can get vaccinated today.
Para concluir, una de las mejores maneras para estar seguro durante este invierno es para recibir la vacuna contra la influenza. Y si usted no sabe dónde recibirlo, ve a la CDC, donde dicen los sitios que hay vacuna contra la influenza.
Muchas gracias for translating for me. Is there anything else you would add to the community, to the Spanish-speaking community?
Esto es lo mismo que nosotros hemos estado hablando ya por muchos meses, la importancia de prevenir contra los virus como la influenza. Tenemos una vacuna ahora que es efectivo y seguro, y es la única manera que nosotros nos podemos proteger durante este invierno por ahora, hasta que haya otra vacuna segura contra la SARS-CoV-2.
Thank you.
Thank you. Okay, I think we are officially done. Thank you all so much for coming. Appreciate it. Thank you, guys.
Thank you. And all of you too, if you haven't gotten your flu shot yet, vaccines.gov, find out where you can get your flu shot. Do it on camera, tell everyone else you got it. This is going to be our most important flu season of our lifetimes, I think, in terms of making sure we keep the curve flattened.